increasing the total funding under the budget. You mentioned you put more money in education. Are you cutting anywhere?
Yeah.
So our overall increase on the overall budget, all funds, is a bigger increase, mainly because of the pull down on federal share on multiple programs. I know on the GRF side of things, we are approximately $775 million under the executive proposal.
So where did you cut?
We went through multiple areas and multiple items, and I don't want to get too deep into the weeds in this conference. We'll have obviously a sub-bill here in about a half hour, so everybody can go through in great detail.
Can you talk about the Medicaid changes? I mean, did you keep in place the funding that the governor put in to continue the expansion of $120 million that would cover that Group A population?
The Medicaid line item is one line item, so it doesn't break out Group 8. There's no $120 million that you see or anything like that. It is not. It's not broken out individually, so it's not something that we even address that way.
So the state share, though, to cover that, is still in there.
There is no state share until the last 6 months.
Right. And so that money.
So if you look at it as a whole, $23 billion, and you cut $2 billion out of it, it doesn't assure you get to Group 8. It just assures you took $2 billion out. That could go to nursing homes. It could go to anything. There's no mechanism there that allows you to take it out directly out of Group 8. It doesn't clarify which ones.
What you're saying is they'll then have to manage that bulk sum.
Correct.
More details on this health savings account. Is this sort of what Indiana did? Is that what you're modeling after?
Yeah, that's exactly right. So it's based upon the Healthy Indiana plan. We're calling it the Healthy Ohio plan, and I know original. And we thought that they were able, obviously, to get a waiver from the Center for Medicaid and Medicare Services, and we're pursuing a waiver that is similar. We're also having a requirement in there that makes sure that an individual who is receiving care is told the price of the care before they receive it, if they want to know the price. And then the second piece is providers right now are prevented by law from advertising prices for their services. And so the third piece there is that now they can advertise their prices for services just like any other service or good that's available for the citizens of the state of Ohio.
Can you explain, I know the foundation formula, no school loses money. What are you guys doing with the TPP phase-out that's proposed by the government?
The TPP phase-out proposed will continue as proposed.
Okay.
So the $179 million that we put in to the formula, actually, speaking of just the formula, increases school district funding for 494 schools.
Right.
So we're 494 ahead. There we guarantee back to 15. So in some instances, when you look at TPP, in some areas they were losing money on the proposed formula plus TPP, so they were kind of double hit. What we decided to do was direct the money into the formula and try to help cushion the blow on the TPP districts that way. And I believe we got it down to 93 districts that are losing money, and obviously that's because of the TPP. But we got it down to 15% overall districts.
So that's overall adding the formula money and the TPP money together, 93 million.
Yes.
So you're guaranteeing districts get no less than what they got in 15.
Correct.
From the foundation.
From the formula.
From the formula. Now,
Yeah.
the governor's argument has been that you're not letting the formula actually work by including guarantees. So at what point do we actually get to a formula, or is this just going to be, do you foresee this as a continuation of guarantees?
No, I think if it was as simple as ADM and who's coming and who's going from a school, it would be easy to follow. But the fact of the matter is it's not. I've said that before. ADM is not the single driver of where this money is going and who's on the guarantee. But this formula, I believe, over the next budget and possibly two, depending on the investments made in the core opportunity aid and the formula itself, I think we will see your guarantees and caps, which we are calling future formula aid, will be paid down over time, and it will get to where it's fully funded that way.
The other issue too, Ken, it's really hard to do this process in a budget period. So that's why the joint educational oversight committee is going to be created, so that we can continue this conversation over time, just beyond the budget period, and have this vetted out and looked at. It also be able to look into issues like how is poverty affecting education, and where is it affecting? What are we doing to really help kind of keep lifting people up through that process? So this is going to be an important step too, to say, look, this is not something you just do in a budget period. You got to continue to focus on it.
So, gentlemen, tomorrow's April 15th, tax filing day for all of us. For some folks, it's also going to be called Fight for 15, raising the minimum wage to $15 an hour. Can you summarize your substitute budget, how wages and benefits are going to be boosted for Ohioans?
I would say, from my perspective, wages get boosted by market forces. And what I mean by that is, we've seen it in North Dakota. As the Bakken exploded, you had people at McDonald's making $16, $17 an hour. That's the kind of market force that raises minimum wage that we want. We want more businesses, more jobs, and be able to raise the tide that way. Something that is important to business, to be able to let it grow and allow the market to determine what level that is, and I think we're on a great trajectory right now.
Now the Ohio, go
I
ahead,
have a
Mr.
comment.
Schaefer.
Yeah, go ahead.
No, go ahead.
Oh, I just also wanted to mention, when we go and we talk with our local businesses now, we have about 130,000 jobs that are open in the state. And they span the gamut of salary ranges. They're not all low salary or entry-level positions. They kind of span the gamut. Some of them are network administrators for $120,000, jobs that are just open that they can't find people to fill. Our employers are thirsty for employees right now. They are absolutely thirsty. In a lot of cases, the employers tell us they can't find people that are willing to show up to work, number one, or committed to kind of the job, and number two is they can't pass a drug test. Those seem to be the two greatest barriers. So we seem to be creating jobs, and interestingly enough, just anecdotally, I can tell you a local factory in my district is actually raising their minimum starting wage from $9 an hour to $12 an hour because they cannot find employees any longer. So that raise may not be up to the $15 that you mentioned, but that raise is beginning to progress as demand for labor increases in the state of Ohio. And I think it's a direct result of some of the reforms that we've made, and in particular the job that Jobs Ohio has done. So.
Thanks.
Were there any school districts cut?
Not in the formula.
On the topic of schools, we know the Ohio Board of Education just did away with the 5-8 rule. Is everybody here okay with that decision?
A lot of policies still.
I think that needs to still be looked through and have some time for us to swallow it all.
The Developmental Disabilities Facility Closure Study Commission, whatever you're calling it, will that be for new closures announced, or will that cover the Youngstown and Dayton centers that have already been announced for closure?
It'll cover the current two.
Those two. So will that effectively postpone the closure of those two facilities until the study commission looks at it?
Well, I think they're on a 2-year path on closure, so I don't know if it will postpone them, but it will happen concurrently, and hopefully see what kind of results come out of it.
Can I make an additional comment on that? I'd have to say, this is part of an overarching federal attempt to dismantle our DD system, quite frankly, in the state of Ohio. They're trying to shut down our developmental centers. They're trying to move away from workshop-based care by not reimbursing us for it through the Medicaid waiver system. And they're saying that our independent providers are committing tax fraud and trying to make the state employees of the independent providers. It's a coordinated effort by the Department of Justice, the Department of Labor, and the Center for Medicaid and Medicaid Services. And quite frankly, we're getting ready to draw a line in the sand for these families because it's taken us 4 decades in order to build this developmental disability system to help some of the most vulnerable in our state. And these families have advocated for the system that we currently have, and we don't feel that it's right to kick them out of their homes in the developmental centers. The developmental centers have people that have highly acute needs, highly involved cases, and quite frankly, they need institutional care. And we've gone from 1,200 in the developmental centers now down to 800, and we think that enough is enough, and we want to make sure that we're looking at this more carefully and that we prevent the wholesale closure of these developmental centers.
So can I clarify, is it possible that the action of this study commission could stop the closing of the Youngstown and Dayton developmental centers?
Yes.
That's what our attempt is.
Can I ask for clarification? You mentioned that you were working toward a work requirement for Wisconsin staff. Does that mean it's in the budget?
This is one of the pieces that we're running both in the budget and then also separately as a separate bill so we can get more focus on it and begin to look at it clearly. Obviously, we don't want to kick people off the system prematurely, but we feel like there has to be a time limit for being on the governmental programs and a time limit for also there comes a time when people need to get back to work, and so we're going to examine that.
If I could add just a bit to that, the administration's proposal, I think rightly, is primarily focused on current work requirements of entitlement programs, which would primarily be focused in work programs on TANF. Our proposal will add to that a voluntary side that's non-entitlement and that will have the ability to be much more flexible to work with those who might already be on an entitlement program or with those who are not. Who also there are probably 10 times more folks who need a trajectory up out of poverty that aren't on work programs now. And so we want to start working in that area in addition to the focus that the administration has. We see what they've proposed and what we're thinking about doing in the Healthier Buckeye program as being very compatible and complementary.
We do 2 more questions and then we got to get this out there.
These study committees that you're putting in here on the tax and the education, are you putting a timeline on when they have to have some of their work done so you'd be able to maybe act on it in this General Assembly?
Well, the Joint Education Oversight Committee, that's a continuing thing, just as JMOC has been and will be. As far as the Tax Commission goes, look, first and foremost, Ohio's doing well. As I said, we're on a good glide path. Things are really well, and I don't think there's a problem to take this opportunity right now to time out a little bit and let everybody catch up. Most importantly, my thing is predictability and allowing companies and others to have that time to know what's coming. So what we want to do is take the opportunity, again, work with the governor and the administration and say, hey, look, we believe in what you're doing, where you're trying to go. Let's put this together in a long-term study commission here that we can all work together as one team, bring in the NFIBs and the chambers and the retail merchants and the Ohio Manufacturing Association, the Manufacturing Policy Alliance, all these groups, and kind of work towards a goal of what's the next scenario to bring us forward. I think it's been 10-some years now since the deal was struck for the 21% reduction in income tax. It's gotten us to where we're currently sitting at. So I think it's high time that we kind of sit together again in the room and start working towards that ultimate goal. I would predict that by the end of at least this General Assembly, we should be able to have strong recommendations going into the next budget to where we can go with that study commission. I mean, we don't want to rush this, and that's our goal, and that's kind of our message. So that's what we're trying to work on. The issues like asking JMOC to review the Medicaid line items and the Grace Commission, I think we're asking those folks to wrap up by the end of this end of this year so that we can act on them we'll see, what year is it, 15, 16, and make sure that we can progress forward. There's other issues though, like in education. Currently, I think in the sub-bill there's a transportation study committee that will ultimately roll into things like the Joint Legislative Oversight Committee, so that we can have this a continuing conversation.
The severance tax, last budget it was in, it got taken out, and the speaker then said, we want to take a better look at it. We expect we'll do something. Came back around the MBR, ultimately didn't get through. What's your expectation for this session then? Is there going to be severance tax legislation? Well, obviously it's a frustration point for the government.
Well, look, I think that what we're talking about is just the same question we just asked. The oversight, the 2020 Tax Commission is going to have a great opportunity to take a look at that in the long term, and what can we do, and where does it all fit into the overall package. So I would say that that's a good option. The House has, as I've said in the past, moved forward with House Bill 375 in the past, and I think we stand behind the work that we did there with House Bill 375. So, well, thank you very much for taking the time to be with us today. We're